Hey girl gang, it's Dr. Joy here, and you are watching Delivering Joy MDTV. Welcome to Well Woman Wednesday, where we've been talking about living your best life in 2023. If you caught last week's episode, you will know that we've been talking about overweight and obesity, which can be kind of sensitive. But today we're going to talk specifically about bariatric surgery, and my boy John Woody is here to tell us all about it. Make sure you keep watching. All right, we're back, and I have with me a special guest, Dr. John Woody Major, and he is a bariatric surgeon and a general surgeon here in West Georgia. So I wanted to ask him some questions about bariatric surgery because this is a subject that's near and dear to my heart because I had bariatric surgery in 1999, and it's come along. There's so many more procedures, it's so much safer, and it can be a great option for people who have a significant amount of weight to lose. So say hi to the people.
Hello, everyone. Thank you, Joy, for having me on.
I'm so excited that you were able to do this with me because I know that we are building our weight loss surgery program here in West Georgia, and I think people really need to know about that. So how did you get interested in weight loss surgery? I mean, we know you're from the surgery dynasty. You know, you got your dad, your brother, and now you've come along. But how did you get into that bariatric area?
So I was fortunate enough to train up in Chattanooga and had a mentor up there who has a bariatric practice. And during my training, I had several elective months where I got to choose where I wanted to spend my focus. So I started thinking about what I could bring back to this community, and I got to see his patients and their outcomes after 3 months, 6 months, a year. Even some patients came back 3 to 5 years out, and seeing the changes that in their lives that was being made through bariatric surgery. So, I thought this is something I could bring back to LaGrange. There was a bariatric surgeon here before me who had a good practice. He was busy, and he was just so happened to be leaving town right when I was getting back. So it kind of worked out well for everyone, and we've started to rebuild the program now.
I do think it's certainly something that we need in this area. We eat real good down here, and some of us don't have the genetics to be able to metabolize all that. Speaking from a personal standpoint, bariatric surgery made the difference in my life. I was 19 years old, so I think I'm 23 years out? 23, 30. I don't know. Anyway, it's been a long time, and I've been able to pretty much maintain my weight, but it is a lifestyle change, and it does help people get to a point where they can then maintain on their own. I know there's several methods several types of procedures you could do. Which types are more common, and what's your go-to procedure?
Yeah. So for bariatric surgery, there are lots of different options. I perform right now 2 options: the sleeve gastrectomy, which is where I make the stomach long and skinny. I remove the majority of the stomach and leave you with basically a banana-shaped tube for a stomach. And this does a couple of things. It restricts how much you can eat, but also removing that large portion of the stomach changes the way that your body senses hunger and satiety. There's some hormones that are changed when you remove that part of the stomach. So both of those things help the patient lose weight. And then the other surgery is the Roux-en-Y gastric bypass. And with this surgery, you make a very small pouch at the end of the esophagus, and you essentially rearrange the intestines so that you have both restriction and malabsorption of your food. So the food will travel for about 150 centimeters of small bowel before it meets all the digestive enzymes from the stomach and the liver and the pancreas.
When you're thinking about how to pick a patient for a sleeve gastrectomy versus a Roux-en-Y gastric bypass, which is what I had many years ago, how do you, what's the ideal patient for either procedure?
Yeah, it's definitely a patient specific. I mean, it's not a one size fits all. I would say that the sleeve by far and away is the most common procedure performed in the United States for bariatric surgery right now, mostly because it's technically not very challenging and you have good outcomes. But like I said, it's not one size fits all. So some patients, especially those with reflux disease, a sleeve has the tendency to make that reflux worse. And so if a patient comes to me and says, I struggle with reflux, you really have to weigh those options. If the sleeve would be the right choice for them. Sometimes getting the weight off alone will help with the reflux, but if there is significant reflux, and especially if I see signs of reflux when I'm doing my preoperative workup, I perform what's called an EGD, where I run a camera through the esophagus into the stomach. And if at that point I see evidence of heartburn or reflux in the esophagus, then that really leads me towards the bypass versus a sleeve. And with the bypass, you have to think about the anatomy, prior surgical history. If somebody's had lots of surgeries in the past, especially open surgery, then they can have scar tissue, and it's more difficult to technically to perform a bypass, especially in the setting of adhesions within the abdomen or scar tissue within the abdomen. So there's several factors that weigh in there. Smokers specifically, when it comes to the bypass, they can develop a really bad problem called a marginal ulcer. And so it's a big no-no to perform a bypass on somebody who's a smoker. I don't operate on anybody who smokes. They all have to quit. But some surgeons would say even, ever operating on a patient and giving them a bypass if they have a history of smoking, because they may always fall back into that habit.
A lot of smokers, and that's something that can kind of hinder folks from getting the surgery they might need. Wow, I didn't know that. Who's eligible for weight loss surgery? Like, this is not something you do because you want to lose 30 pounds. Like, how do you, who's eligible? So how can people know if they should even come for a consultation?
The big reason we do bariatric surgery is to make people healthy. That's the overall arching theme of bariatric surgery. We want you to be healthy. And so along with that, insurance companies have decided that they'll pay for people to have bariatric surgery, given that they fall into certain criteria. And generally it goes, if your BMI is over 35, which would be considered obese, and you have a comorbidity that is linked to obesity. That's comorbidities can be high blood pressure, high cholesterol, sleep apnea, diabetes, type 2 diabetes, osteoarthritis. We see a ton of patients with joint pain, polycystic ovarian syndrome. There's several more, but basically if you have a obesity related comorbidity or disease, then your BMI has to be above 35. If your BMI is above 40, then most insurance companies will authorize you to have bariatric surgery without a comorbidity. But I will say it's pretty rare that you see somebody with the BMI over 40 and they don't have at least one, obesity-related comorbidity.
The other day we were at work and talking about just how young folks are really struggling with obesity. And you're telling me, oh yeah, I've seen even younger people, even in their teens, needing to come in. Why do you think, or how do you think we got to this point as a community, or just in the U.S. in general?
Yeah, that's a great question. I think a lot of it's culture. We grew up eating good food, eating too much food. And I think that genetics definitely plays a big role. I mean, I have patients who come to see me, and they're not doing the wrong things. They're drinking water and they're eating small portions and they're exercising, but they're still struggling with their weight. So that's when it's really frustrating for the patient, and that's when bariatric surgery can really make a big difference for them, because it'll get them that jump start that they need to start to see some changes with their body, with their health, and then that motivates them even further to keep the weight off long term. As far as the young people, yes, there are. And when I was in Chattanooga, they started a pediatric bariatric program, and they had several, young adults anywhere from ages 14, 15 up to 18 who, were overweight and met criteria, and were getting bariatric surgery at that point. We do not operate on, juveniles here in LaGrange, but I do have patients that have come to see me that are 18, 19 years old.
I think about it a lot as a OBGYN, as these young women in particular are nearing their childbearing age, and they, have significant comorbidities. I mean, diabetes, hypertension, their body mass index may be anywhere from 40 to 60, and then we think about how we're going to help these people stay healthy and carry a pregnancy and then birth. It's a little daunting, to see that people are getting sick younger and younger. People often say that going through bariatric surgery is taking the easy way out, right? And they say, oh, you ought to be able to just stop eating. You ought to be able to exercise. And like you said, some people are doing the right things, but they're just not getting the results. How do you counsel patients or family members in particular when they kind of try to deter people from looking into bariatric surgery?
You will find people in the medical community that are naysayers for bariatric surgery and think it's a bogus thing to do. But I mean, once you start seeing people like we spoke about earlier who are doing it all right and they just can't lose weight, and you get your hands, and you operate on someone like that and see the difference that it makes. And you see them come back to the office and their energy levels are up, their knees don't hurt anymore, they're off all of their hypertension meds, all of their diabetic medications. That's when it really, you kind of have to see both sides. You can't just not know enough and then make that kind of opinion on it.
I agree. I see so many people who say, well, I just ought to be able to do this on my own, and I don't understand why I can't. And I'll kind of start gently nudging them to your office because I say, hey, you've got to get a handle on this before it completely ruins your health. And I think people do believe that it's taking the easy way out. Sometimes the patients themselves and sometimes other people say, well, you shouldn't do this because, you're taking the easy way out. But I don't look at it that way. And so I'm very open with sharing my story with people and say, no, it's not easy. Every day I still have to work out. I still have to, you see me in the OR lounge with my little factor meals because I have to control portion size. I have to control calories and carbohydrates. So, I think it's so important that people understand out there that this is not just an easy way out, because the surgery only works if you work it.
Far from easy. You have a usually 3 to 6 month medically supervised weight loss period before you even get to surgery. And you have to prove to me that you can lose weight during that time, or I'd like to see you lose weight during that time. Some people, like I said, really struggle to lose a pound, but generally most people are able to lose some weight during that period. And that shows me that mentally they are, they're bought in and they want this. And then, the pre-op diet and the diet right after surgery. I mean, it's pretty hard. Those people drink a lot of protein shakes, and and then once they get their lifting restrictions cleared, most of them are at the gym trying to, work hard, because the first 6 months to a year is really the biggest weight loss period, and they understand that. So.
Yeah, absolutely. When I had my Roux-en-Y gastric bypass, I was in college at LaGrange College. And I remember trying to jog over to that little workout center they had and walk back and lift weights and do all these things, because that where I started and where I ended up a year later, pretty much right at that maybe 18-month point, that's the size I've been ever since. So, you're right. You got to take advantage of that first year or so to be able to get down to where you need to be and stay there. Now, one thing I experienced was during med school, which was about almost 10 years later, is I had a weight regain. Do you see people that regain their weight, or even all of their weight, a portion or all of it?
Yeah, unfortunately, we do see that. That's, kind of the one thing we don't want to see is that, and unfortunately we do. We try to make it really, really pounded into people's head how important it is when it comes to lifestyle choices and diet and exercising. It's one of those things that you're predisposed to obesity. So, you're going to work hard to get through to surgery. You're going to put yourself through, thankfully it's a small risk of surgery, but there's risk with surgery, and you're putting yourself through that, and you're putting all this work in. So to fall out, 18 months, 2 years, 3 years, to fall out of habit and to fall back into your old ways is really frustrating for me. I know it is for them too, but I just hate to see patients that have significant weight regain. A lot of patients will have gain some weight and then kind of come back down and yo-yo a little bit.
I'm definitely a yo-yoer, but I pretty much maintain my weight within 10 or 15 pounds. Like I don't usually get too far, because once I start kind of climbing, then I'm like, oh no, like we got to go back the other way because I'm not doing this again. So are there surgeries that or procedures that folks who have had a previous weight loss surgery that they can do to kind of help give them some more restriction or some more malabsorption?
The sleeve conversion to bypass is something that I do, and I've done quite a few of them here in LaGrange. Most of the time, that's more for reflux problems, but also weight regain. So conversion from the sleeve to the bypass, you're going to fix the reflux problem, but also you're going to gain some extra weight loss through that conversion. Usually you can lengthen the roux limb to make more malabsorption.
Good to know that those things are out there. One of the reasons that I had a weight regain though was because I was not following the lifestyle methods. I didn't do the behavioral modification courses. I didn't do the support groups. I didn't do any of that. And I know recently here in West Georgia, we just got accredited as a weight loss center of excellence. Is that how you say it, or what's the special designation you guys just got?
Bariatric Center of Excellence.
Okay, wow. And so what goes into that, like building that program?
Basically, it is a way for them to ensure that you're performing bariatric surgery at a high level, meaning that you have all the puzzle pieces in place, such as dietitian, exercise program, support groups. You have a dedicated coordinator, which we do, and they put together workshops for education purposes. And then they look at the cases that we've done. They look at every case that we do. They look at our volume. They look at our outcomes. And they even spoke to anesthesia. They spoke to the nurses on the floor. They spoke to the emergency room staff. I mean, it was extremely thorough and comprehensive. I was kind of surprised how in-depth it was. But we had that back in, I guess it was December. And we found out about a week and a half, 2 weeks ago that we passed. So we're officially a center of excellence, which is a great thing to have just for the patient, because they know that things are being done well in that hospital, but also it allows some insurance companies to pay our hospital for the procedure, because they will only have their patients go to centers of excellence. So it was a really big deal for us.
Well, congratulations on that. I think that's great. I mean, you've come in to do some surgeries with me, and I can vouch for you. You're doing a great job. And, John Woody is the man when it comes to that robot. So I've learned lots of little tips and tricks from you there. And I'm just so excited that we have this center of excellence, because I think that it can add a lot to folks' weight loss. When I went back, I think I was maybe graduating med school, and I went back and joined the exercise and the behavioral modification and the nutrition. And that's really what got me back to my regular weight. So I do think that having all of those programs is absolutely essential. You talked a little bit about what people need to do in order to qualify. Will you kind of go a little deeper on that? So let's say I walk into the office and I'm like, okay, Dr. John Woody, I want to have a vertical sleeve. What happens from there? Like, how do I get from just thinking about it to actually getting on the table?
You call my office, 706-880-7450. I can squeeze people in here and there. And the first thing we do is we just have a conversation. I ask you about your weight. I ask you about how long it's been an issue. I ask you what you've been doing about it. And we kind of go through your diet and your exercise, what your habits are. And we talk about what changes you may or may not need to make. And then we talk about your medical history and your surgical history, and we come up with a game plan. I explain the different procedures and why one may suit someone better than someone else. We set a date for our EGD. We do some lab work to check some vitamin and mineral levels. And then from there, you go out and you do all of your education with dietary. You have to have a psych eval. Every patient has a psychiatric eval.
Interesting. And I've read that and I've heard people talk about that, but what exactly is that for?
Well, they want to make sure people are mentally prepared and capable. It's a really big deal to lose a lot of weight. I mean, it changes your life. So you want to make sure that, you know, the patient can handle that, because some people can't. I mean, you hear about divorce rates in post-bariatric patients.
What?
Like women who have never been from the opposite sex, and all of a sudden they lose, 100 pounds, and they're starting to get more attention from the opposite sex, and next thing you
like lose their minds, like, oh yeah, I'm out here now. Now I can tell you, as a young adult, matter of fact, I'm going to put up this before and after picture of me. I think I always had a lot of attitude and kind of sass, but boy, after that first 100 pounds fell off, I was off the chain. Like I was dressing in leather pants and just doing everything. So I guess I could see that. And it is definitely a big deal. Like the whole way you think about yourself changes. And I remember I used to like to shop at Lane Bryant at the mall. And then there came the day that I was too small for anything they made. And I didn't know where else to go to buy clothes or what to do. I mean, it's a huge lifestyle change. So many of us have these memories and things we formed around food. And now you can barely eat any food. So you can make a whole plate and look at it, but you can't consume that much. And so it kind of makes mealtime not as fun with your family or, Christmas time or whatever. And, that whole dumping syndrome that people can get like after they've had surgery.
Body will tell you when to stop.
Yeah. I mean, tell you, it's a hard stop too, because if you overeat, you're going to be barfing in the bathroom. So it's definitely not something that you want to engage in. So I guess I could see that mental piece is really important. Okay. So I get my mental health assessment, and then what?
Yep. So you speak with Debbie, our dietitian, who is awesome. She's been in bariatric programs for 10 plus years. Melanie does a workshop. Tanya helps with the insurance approval and making sure you get all your consultations. Some people need, depending on their health, cardiac or pulmonary or endocrine clearance. And then once you kind of get all those hoops jumped through, with the supervised weight loss, medically supervised weight loss, usually it's 3 or 6 months of medically supervised weight loss with your primary care physician. So once you do all that, and I've done the EGD already, run the camera down, then you come back to my office and we talk more about the plan, make sure nothing's changed, make sure everybody's comfortable with the plan. We go back through all the risks and benefits of the surgery itself, and then we pick a date. And it's usually about 4 weeks from that preoperative visit. And they start their pre-op diet, which is a lot of fun.
Ooh, what's on the menu?
Liquids.
Oh, like liquids for like 4 weeks?
No, it's 2 weeks of a liquid diet, but you get one sensible meal at night. Okay. So it's shakes for breakfast and lunch.
Okay, so a shake for breakfast, shake for lunch, in a sense, it's like kind of like Slim Fast back in the day. I don't know if you're old enough to remember Slim Fast, but I do. I was probably drinking it as a kid. What are some of the risks of bariatric surgery that people should be aware of?
Yeah, these patients are sick. Not a normal, healthy person for their age. They may only be 35, but with all that weight and their comorbidities, they're going to be more sick, which leaves them prone to more problems with anesthesia specifically. Blood clots is a huge problem that we try to navigate around. We give blood thinners before surgery, all after surgery. So you're going to be on heparin the entire time you're in the hospital, which is only, usually about 30 hours, but, and you're up moving, walking right after surgery. We want you moving. The surgical risk is bleeding and infection. Anytime you cut the skin, those are the two possible problems. And then more specifically, risks with the sleeve would be the risk of reflux, but that's usually a good ways down the road. The staple line, where I remove that part of the stomach, it could always leak. Thankfully, that risk is very low, and we do a leak test on all of our anastomosis before we get out of the operating room to make sure there's not a hole. And That's probably the biggest risk for the sleeve, is just having a leak or a postoperative bleed. Anytime you cut through the muscular wall of the abdomen, you can develop a hernia after surgery. So that would be a risk as well. And then for the bypass, it's got a couple of different things going on. The marginal ulcer I spoke on earlier, where you can get that hole between the gastric pouch and the small bowel. That's usually people who smoke. And then there's also something called an internal hernia, where when I'm sewing the small bowel to the stomach up here, you have this potential space that kind of exists. And I close that space with suture at the time of surgery, but as you lose weight, a lot of that weight is on the inside. And so those spaces can open up, and something called an internal hernia can happen. And if that internal hernia happens, it has to be fixed urgently, because the other small bowel can slip in there and get kinked off, and it can be compromised and become ischemic with that blood. So that's about a 4% lifetime risk of that happening.
Okay. Pretty small.
Yeah, it's a small risk, and the risk of having a major complication, if it does happen, is even much lower. Usually people with an internal hernia will just feel poor. They might have a bowel obstruction of symptoms, like they're not passing gas or having bowel movements like normal, and then they'll be nauseated.
Okay. All right. So those are good things to know. In terms of overall how people are going to do down the line, do you think it's worth most people taking that risk?
I'd be willing to bet that 95% of the people who have ever had an internal hernia after bariatric surgery would still say it was worth it.
And I actually developed a complication when I was in residency, and I had I guess it was like an ulcer that almost eroded my gastric wall, the little pouch I had left. And I got really sick, and I had to have emergency surgery. And I just happened to be at the hospital where I had my surgery when I got really sick. So people ask me like, oh, I can't believe you would advocate for people to get this when you had a complication. And I'm like, well, complications happen, every day with all types of surgery, but still in a heartbeat, I would do it again because of the life change that I had. So I think, focusing, it's good to know what the risks are and the benefits, and to have a good relationship with your surgeon so that if something goes wrong, you can come back and say, hey, something's up, and get it fixed. But I still, in a heartbeat, would do it all over again, because it's just I can't even explain how much it can change your life to lose, over 100 pounds and be able to do the things that you love. What's one thing that you would like to leave with the West Georgia community about bariatric surgery and about the opportunities that are now in our neck of the woods?
I think just do your own research, and the more you know, the better. A lot of people come into my office very well read on bariatric surgery. I'm explaining things to them that they already know, and that really goes a long ways with me. Just knowing that you're already committed enough to start to do some research on your own. If nothing else, just try to reach out to people that you know of who've had bariatric surgery, and try to glean information off of them. You can attend our support groups without ever coming to see me. Follow us on Instagram and Facebook, all kinds of motivational things that we post, and it's a good way to connect with us and sign up for one of our workshops or one of our support groups. And we're just very approachable and want to help.
I love that for the community, and I'm so glad that you guys are offering this service and that we're rebuilding our center of excellence here. And I just think it's such a great opportunity for folks to get in touch and just kind of see what the opportunity is for them to improve their health and improve their life. So thank you so much for coming on tonight, Dr. John Woody Major, and explaining to us about what sort of bariatric options there are here in our town.
Thank you, Joy. I enjoyed it.
I know you learned a lot. I did. We'll catch you next time. Peace.